Yes, I'm Alice, a healthcare lead. I'm an architect and also an interior designer based here in West Yorkshire at P+Hs Architects. I've specialised in healthcare design for about 13 years now, and I have a passion for improving healthcare environments and researching best practice both from the UK and abroad. And thank you for the opportunity on behalf of Architects for Health to be on the panel today. This is a really great subject, and that as advocates for best practice in healthcare design, Architects for Health are really passionate about. So today we're talking about the infrastructure that surrounds the future of healthcare in West Yorkshire. We'll be exploring trends from the UK and abroad and how investing in infrastructure can transform lives. Infrastructure is a very broad topic, so I'll be talking about a few key points that will cover aspects of what makes a healthy environment, what we can aspire to in the future, and a few case studies of how this is being achieved, both from the UK and abroad. We know that the healthcare system in isolation is struggling. There's an estimated £9 billion worth of backlog maintenance, not to mention that 1.5 billion and rising is a health risk to the life of patients and staff and needs to be addressed. Hospital sites generally need upgrading nationally, but what other areas of infrastructure leading up to hospital admissions do we need to improve across the region to improve the health and well-being for all generations? And how can we improve our social care system and regenerate deprived areas? So many of our health issues that we see today are actually preventable or can be improved through careful understanding of the local community's needs and bridging inequality gaps through improving our local infrastructure. Thoughtful design and creating healthy, high-quality places that are well connected and supported should be the foundation that strengthens community, creating opportunities to socialise and encourage positive activity. So the wheel that's shown here is taken from the World Health Organization's vision for healthy cities. You may be aware of this movement already. I've just placed it here along with the key checklist, just as a reminder for what attributes are globally recognised to create healthy cities. And, just to summarise quickly, these cities lead by example in order to achieve change for the better. And the aim is to tackle inequalities and promote good governance and leadership for health and well-being. And most importantly, what's really great about this is their vision starts with people. And a healthy city takes a human approach to development. It prioritises investment in people, ensuring access for all to common goods and services. So there's more information on their website about this initiative and how to take part. So whilst we're focusing on people as a starting point, I'm just going to dive straight into specifically the NHS Workforce and the current built environment within which they work, just to emphasise really how important this is for infrastructure in the future of healthcare. The workforce and the individuals who provide care are very much affected by the healthcare environment on a day-to-day basis. I'm just going to read out a couple of key facts quickly from the King's Fund website that carried out some research into staff welfare. So even before the pandemic, the workforce crisis was the biggest challenge facing the health and care system. NHS hospitals, mental health services and community providers were operating with more than 100,000 full-time vacancies. Staff were working under strain, with 40% of respondents to the survey reporting that they felt unwell due to work-related stress in the last year. And a majority, so that's 51%, over half, are thinking about leaving their current role, and 21% want to quit the NHS altogether. So it's really, really clear that improved staff environments are key to creating a sustainable workforce. And in upgrading our hospitals and healthcare premises, it is important that we create adequate breakout spaces and rest areas, rooms for private one-to-one conversations, changing the brief a little bit on what we're providing for them at the moment as a minimum. Their health and well-being is really important so that they can deliver the best care possible. Hospitals of the future should become a place of choice to work due to the amenities and the culture of the workplace. P+Hs asked staff at an existing trust here in West Yorkshire what they would like to see for their staff areas in the new building, and they referred us to companies such as Google and Patagonia due to their working culture. And as architects, we can only do so much. The culture and the operational principles for staff welfare also need including as part of any upgrades. Let's click on to the next slide. And every development, from the big to the small, that gets built today and in the future, should, where possible, incorporate a wider picture that is the health of the local community. Evolving the culture of our built environment through embedding healthy living within our policy frameworks will help us to drive towards this vision. Developers need to be motivated to provide healthy spaces of their own accord. If responsibilities for achieving these aspirations are clearly defined, designers and developers can work harmoniously together in creating sustainable and healthy communities. And there are many opportunities to build communities where people want to engage with one another, to encourage to motivate individuals to take ownership of their own health needs. So what can be done in the future to prevent loneliness in older adults, or, create spaces that encourage social interaction? How can we destigmatise mental health services or even make sexual health clinics easily available? So an example of how this cultural shift is happening here in Leeds is where we've adopted a Scandinavian urban principle to improve the overall quality of life for residents. So the Situ development, which is located centrally in a former brownfield site, is the master plan for the new climate innovation district. It's been developed with Scandinavian firm White's architecture to convert the space into a sustainable mixed-use neighbourhood of more than 500 apartments and homes. So it's quite a lot of it's complete now, actually. The development has got a really high standard of environmental performance. It's got fully integrated services that are well connected. It's got schools, commercial offices, manufacturing, as well as healthcare. And the resilient development has wide access to a range of social and green space to encourage social interaction, physical activity and play with non-vehicular movement, as the design is, it's more pedestrian and cycle friendly. So the Situ development is a start. It's just a section of one city in West Yorkshire. So what more can be done in the future to connect other parts of our cities and their wider suburbs? A great example from the US is the Highline Park. It's a new artery of green space that connects several areas of New York City. It's a really clever use of an old elevated railway track, which now takes pedestrians off the street of New York into nature. I've been there myself. There's little bird boxes and reclining seats and amphitheatres which form part of the public realm. And, it's a really attractive, joyful space. It's, and it takes you on a journey through some amazing architecture as well. It really stitches the city together. And Leeds has some great ambitious plans for a further 100 kilometres of cycle routes. This will mean a lot of clean air and a greater connection with nature, and it'll be a big boost for physical and mental well-being for residents. And, across the way, our neighbours in Manchester, they're building the B network, which is a really great emblem of nature and is now connecting loads of different communities with cycle lanes and walking routes around Greater Manchester and the city itself. So again, we can look to Scandinavia for best practice for many aspects of healthy living. One of these aspects is how they value multi-generational living. So there's an image to the bottom left there. It's from a concept image for Generations House, which is actually now built and operational, and you can look at it online. There's some as-built pictures. It's really beautiful. It's located in Aarhus and it's based on life and community. It'll be the first of its kind in Denmark and has been tested on smaller scales. It delivers on Aarhus's district's vision of bringing together several generations under the same roof. 40 of the units are designated youth homes, 100 are for the elderly, and 24 are reserved for adults with different disabilities. And in addition, the building will contain 40 family homes, a number of common areas, including a nursery for 150 children. So here, children, young people, adults, and the elderly will all be able to coexist. The layout's been designed in such a way to create opportunities for residents to meet by sharing resources and taking part in communal activities. The building houses function rooms as harbour setting with sailing boats and kayaks, workshops, children's playgrounds, etc. There's even a mini zoo. And the need for providing additional care homes was identified by the local council and therefore included within the city's master plan. But the city was really intent on providing care dwellings mixed with other programmes, as care for the elderly in Denmark generally is heavily based at home. It meant that residents here that needed extra care had more significant care needs, with a higher proportion of individuals that had dementia. And in order to make the new development work, the local authority had to collaborate with the Ministry for Children and Youth, the Ministry for Health and Care, the Ministry for Social Relations and Occupations, and housing associations. And in the north, we're starting to develop schemes of a similar sentiment, which will enable children and the elderly to be more connected. And this will have many benefits, such as freeing up time to care within the community and stimulating minds and creativity and preventing dementia. So the image to the top left there is another example from Denmark. It's the proposed House of Food and Culture, which is located strategically in a prominent location in Frederiksberg, Arla, Copenhagen. It's built on top of a proposed metro station. So it's very well connected, and it's intended to be the capital's new meeting point with a daily footfall of up to 10,000 people. And the first 2 floors will house culinary experiences, workshops, educational facilities. So here in West Yorkshire, on a much smaller scale in Seacroft, we have a new community kitchen. But maybe in the future, perhaps we could build on this, make it more of a prominent community amenity on the high streets in West Yorkshire to educate about nutrition. So I'll now just move on to talk about variations of accessible health facilities. So in the north, we P+Hs have delivered the first and actually currently still only BREEAM outstanding health hub in Horton, which is the picture to the bottom left. And the development combines medical care, wellness within a sustainable development close to where people live. Traditional healthcare services are provided alongside services previously accessed through hospitals, including X-ray, minor surgery, and a 24-bed rehabilitation unit. It's located adjacent to an existing leisure centre, and the new facility is a landmark for community healthcare. And externally, the site offers wide-ranging exercise options. It's got skateboarding, a trim trail, games pitches, etc. And we're also currently involved in early stages developing integrated health hubs here in West Yorkshire at the moment. It's a bit too soon to go into them in detail. But we have been working with local CCGs and helping GPs to work collaboratively to join together in creating more streamlined, flexible and accessible care services. They're located close to transport links. So one of them is a new health hub proposed for Castleford and plans to be centred and integrated as part of the community strategic master plan with improved transport and upgraded pedestrian links. The image to the top left there is of the new Maggie Centre at Leeds St James's Hospital, which we're really fortunate to have one of these. It's a welcoming, well-crafted space with a high-quality finish, and it welcomes any member of the public affected by cancer. It demonstrates a quality and budget that really make the difference in creating a sustainable community and effective healing environment. It is an example here on how we're relying on charities, really, to bridge the gap in creating uncompromised quality. The detailing and creativity is really inspiring. Surrounded by greenery, it's got double height spaces, it's purely a therapeutic space. and the importance of which, is really acknowledged for supporting survivorship. Improving the quality of our care environments within our community is, key to achieving long-term value. So I suppose, another question is, could we think a bit more flexibly about some of these spaces? Could we open them up out of hours and share some of these spaces if we need to think a bit differently about budgets? So just moving on to acute care, there's probably not a super hospital solution to the general future health of West Yorkshire, but regenerating our hospitals and building new hospitals will form part of this. Providing more specialised network of hospitals is probably more likely, that are intelligent and smart, that integrate digital state-of-the-art technology and allow for fluctuations in demand for beds. So building the need for now and the future is a challenge, especially with the constant advancement of medicine. It's sometimes hard to predict the future, but we will always have a need for inpatient accommodation and acute facilities. But the frequency and the duration of our stay may change. The provision of single beds are becoming the standard in the Nordics and other areas of Europe, and there's evidence-based design that demonstrates patients heal faster, have less disruption. Although again, it comes down to whether or not this is an appropriate way to manage the wards. But now, with things such as COVID, it might be something we may think about differently as well in the future. So an example of how this is managed is through a case study here, which there are images from, which is a hospital in Basel, which I visited a couple of years ago. It had just been built. It's in Switzerland. It's 280 beds, including a private ward. It's called Felix Platter. And it's the largest centre for geriatric medicine and rehabilitation. It's also a university hospital. It combines expertise in acute geriatrics, geriatric psychiatry and rehabilitation, all in one facility. The wards are arranged in pairs and they work together for flexibility. You can see a bedroom on the bottom left there with a thin line sort of in the ceiling. So the bedrooms are designed to house two beds, but they're generally provided as a single room. So when there is a need for flexibility or patients can be paired, they are. I know with geriatric care, sometimes it's better to have two people in a room to help with observation rather than having single rooms. There's also a mobile digital trolley which identifies on each ward when there's a hive of activity in the adjacent ward, so that staff can move across and provide extra support and flexibility. So another example is an increased use of patient hotels. There's one recently been built in Copenhagen, which is really beautifully designed. We refer to this sometimes as step-down care, and this is part of the hospital infrastructure, but for less acute illnesses on patient journeys home. So you may see more of this too, which will free up care within acute hospitals, within acute areas of the hospital. And we will also see a lot more personalisation of healthcare, people taking more responsibility for prevention. We'll probably have a lot more apps and getting to know individuals' needs. And also when we're designing, a key element of success is really designing from the perspective of the service user. So this is something that Scandinavia do really well by focusing on the actual outcomes. And we need to stay genuinely focused on society, health and well-being by looking towards people as the inspiration. Okay. So thank you all for listening. If Architects for Health can help anyone here today, please get in touch. And there's some contact details on the slide here. And there's also some further reading notes there. And yeah, thank you very much. That's all. Sorry if I went over. I added a few things at the last minute.
No problem, Alice. No problem at all. Thank you so much for a